So I think cosmeceuticals are a very important part of our skin therapeutic regimen, whether we're treating medical skin disease, aesthetic skin disease, or sort of combining. And in my practice, one of the focuses is to use cosmeceuticals as a tool to make the procedural modality more effective. And I was able to discuss several different scenarios where we do that. And one of the most interesting examples is how to combine cosmeceuticals both pre-treatment and post-treatment with chemical peels or microneedling. One of the things that I find very interesting is the use of vitamin C as well as soy-based cosmeceuticals, which we've done some research and publication on, to really find out if they have efficacy in treating hyperpigmentation, acne scars, and even photoaging pre-chemical peel and pre-microneedling. And what we tend to do a lot is combine different modalities. So one of the things we've had an opportunity to discuss is how can you make a chemical peel more effective instead of simply doing a salicylic acid peel for acne or oily skin, combining more than one chemical peel ingredient to make the procedure better, but pre-treat these patients with cosmeceuticals and anti-aging peptides to make their skin already more primed or prepped for the cosmetic procedure. Well, one of the things that's interesting is, for example, I do a lot of skin of color in my practice. My practice in Texas is skewed predominantly for a darker skin type population. One, because that's my area of clinical research and focus, but also because that's an interest of mine. And in these patients, it's very important to be cautious and cognizant of what type of physical modality treatment you're doing, because the post effect of the procedure, especially during the healing phase, for example, post-peel or microneedling, can oftentimes lead to other sequelae like post-inflammatory hyperpigmentation and even scarring if you don't treat these patients with the right modalities. And that's why I think the pre-treatment ultimately helps the healing. So I'll give you an example. I have a lot of patients who come in from Indian skin type origin, African American skin type origin, who have acne scars or sort of those ice pick-like acne lesions. Maybe they've been on isotretinoin, maybe they've been on other acne therapies, but a lot of these patients are more concerned about the aesthetic improvement of skin tone and evenness. And in those patients, using a vitamin C as well as a retinol combined prior to doing sequential peeling, then while they're doing the peeling, combining more than one acid instead of just doing salicylic acid monotherapy. For example, in these situations, a lot of times I combine salicylic and mandelic acid and do sequential peels, usually one sitting every 3 to 4 weeks. And then the patient continues with the vitamin C and the retinol post-peeling to really ultimately improve that epidermal cell turnover and helping with collagen synthesis. We do have studies that show that using cosmeceuticals, particularly antioxidants, does help to increase the recovery time duration in terms of the patient recovering faster from the procedure. One thing I will mention is we do also quite a bit of work with microneedling, and we're doing some studies now on microneedling with melasma and with post-inflammatory hyperpigmentation, and studying to see if microneedling would allow you to create small microscopic channels in the skin through which you can then deliver cosmeceutical agents. Particularly, for example, could you microneedle in a melasma patient and then do a topical tranexamic acid serum or a vitamin C serum or a combination serum and then make hopefully the improvement of the melasma be even better? Well, we haven't published the results yet. We're currently doing a study. We have 13 patients in this split phase trial, and the results are very good so far, I can tell you.